Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without delay, let's get started.
The male client diagnosed with essential hypertension has been prescribed an alpha-adrenergic blocker. Which intervention should the nurse discuss with the client? 1. Eat at least 1 banana a day to help increase the potassium level. 2. Explain that impotence is an expected side effect of the medication. 3. Take the medication on an empty stomach to increase absorption. 4. Change position slowly when going from lying to sitting position. The correct answer is 4. Change position slowly when going from lying to sitting position. Orthostatic hypotension may occur when the blood pressure is decreasing and may lead to dizziness and lightheadedness, so the client should change position slowly. The potassium level is not affected by an alpha-adrenergic blocker. Impotence is a major cause of noncompliance with taking prescribed medications for hypertension in male clients. Noncompliance should be reported to the HCP immediately so the medication can be changed. The medication can be taken on an empty or a full stomach, depending on whether the client becomes nauseated after taking the medication. To answer this question correctly, you should understand the side effects of medications. If you do not know the side effects, you may realize that hypertension is being treated and that hypotension is the opposite of hypertension and might be a complication of treating hypertension. Only option 4 refers to hypotension, providing advice on how to avoid orthostatic hypotension. The client diagnosed with essential hypertension asks the nurse, "Why do I have high blood pressure?" Which response by the nurse would be most appropriate? 1. You probably have some type of kidney disease that causes the high BP. 2. More than likely you have had a diet high in salt, fat, and cholesterol. 3. There is no specific cause for hypertension, but there are many known risk factors. 4. You are concerned that you have high blood pressure. Let's sit down and talk. The correct answer is 3. There is no specific cause for hypertension, but there are many known risk factors. There is no known cause for essential hypertension, but many factors, both modifiable and non-modifiable, are risk factors for essential hypertension. Kidney disease leads to secondary hypertension. Secondary hypertension is elevated blood pressure resulting from an identifiable underlying process. A high salt, high fat, high cholesterol diet is a risk factor for essential hypertension, but it is not the only cause. Therefore, option 2 would be an incorrect answer. Option 4 is a therapeutic reply that is inappropriate because the client needs facts. When clients request information, the exchange should not address emotions. Just facts should be given. Therefore, option 4 can be eliminated as a correct answer. The client diagnosed with essential hypertension is taking a loop diuretic daily. Which assessment data would require immediate intervention by the nurse? 1. The telemetry reads normal sinus rhythm. 2. The client has a weight gain of 2 kilograms within 1 to 2 days. 3. The client's blood pressure is 148/92. 4. The client's serum potassium level is 4.5 milliequivalents per liter. The correct answer is 2. The client has a weight gain of 2 kilograms within 1 to 2 days. Rapid weight gain, for example, 2 kilograms in 1 to 2 days, indicates that the loop diuretic is not working effectively. 2 kilograms equals 4.4 pounds. 1 liter of fluid weighs 1 kilogram. Normal sinus rhythm indicates that the client's heart is working normally. The blood pressure in option 3 is not life-threateningly high and does not require immediate intervention. Loop diuretics cause an increase in potassium excretion in the urine. Therefore, the potassium level should be assessed, but 4.5 milliequivalents per liter is within normal limits. The phrase, "requires immediate intervention," should make you think that the correct answer will be abnormal assessment data, data that require medical intervention, or are life-threatening. Which individual is at greatest risk for developing hypertension? 1. 45-year-old African-American attorney. 2. 60-year-old Asian American shop owner. 3. 40-year-old Caucasian nurse. 4. 55-year-old Hispanic teacher. The correct answer is 1. 45-year-old African American attorney. African Americans have a higher risk of developing hypertension compared to other ethnic groups. This is due to genetic factors and higher prevalence of risk factors such as obesity and diabetes within this population. Additionally, age is a risk factor for hypertension, with the risk increasing as individuals get older. Therefore, the 45-year-old African American attorney is at the greatest risk for developing hypertension compared to the other individuals mentioned.
The patient has portal hypertension and hepatic encephalopathy secondary to liver disease and is being treated with lactulose, which laboratory result will the nurse check first to see if the medication is having the desired effect? 1. White blood cell count. 2. Ammonia level. 3. Potassium level. 4. Platelet count. The correct answer is 2. Ammonia level. Rationale. The healthy liver breaks down ammonia, but in liver disease, the ammonia accumulates and serum levels increase. Lactulose helps by enhancing intestinal excretion of ammonia.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case. A client with peptic ulcer disease is taking a histamine 2 receptor antagonists. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Limit gastric acid secretion. Histamine 2 receptor antagonists reduce gastric acid secretion. Antisecretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms.
A client with macrocytic anemia has a burn on the foot and reports watching television while lying on a heating pad. Which action should be the nurse's first response? 1. Assess for potential abuse. 2. Check for diminished sensations. 3. Document the findings. 4. Clean and dress the area. The correct answer is 2. Macrocytic anemias can result from deficiencies in vitamin B12 or ascorbic acid. Only vitamin B12 deficiency causes diminished sensations of peripheral nerve endings. The nurse should assess for peripheral neuropathy and instruct the client in self-care activities for diminished sensation to heat and pain. The burn could be related to abuse, but this conclusion would require more supporting data. The findings should be documented, but the nurse will want to address the client's sensations first. The decision of how to treat the burn should be determined by the physician.
Which OTC herb should be usually recommended for a client with a cold who has mild hypertension? 1. Hawthorn. 2. Ginger. 3. Garlic. 4. Golden seal. The correct answer is 3. Garlic. Garlic is used for colds and the flu and can also be given for hypertension. It causes mild vasodilation and will not make hypertension worse. Hawthorn is used for mild hypertension, congestive heart failure, and angina, but it does nothing for a cold or the flu. Golden seal is used for respiratory, digestive, and urinary infections, but it increases the effectiveness of some antihypertensive medications, beta blockers, and antidysrhythmics. It should be used with caution in clients who have cardiovascular disease, diabetes mellitus, or glaucoma.
When a client is diagnosed with aplastic anemia, the nurse should assess the client for changes in which of the following physiologic functions: 1. Bleeding tendencies. 2. Intake and output. 3. Peripheral sensation. 4. Bowel function. The correct answer is 1. Aplastic anemia decreases the bone marrow production of red blood cells, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. A change in the client's intake and output is important, but assessment for the potential for bleeding takes priority. Change in the peripheral nervous system is a priority problem specific to clients with vitamin B12 deficiency. Change in bowel function is not associated with aplastic anemia.
The pediatrician has ordered vitamin K 0.5 milligrams IM for a newborn. The medication is available as 2 milligrams per milliliters. How many milliliters should the nurse administer to the baby? Calculate to the nearest hundredth. To solve this problem, you set up the formula as 2 milligrams over 1 milliliters equals to 0.5 milligrams over x. You cross-multiply 2 times x and 0.5 times 1. You get 2x equals to 0.5. You divide 2 on both sides, and you get x equals to 0.25 milliliters. This is the amount that the nurse should administer for each dose. The male client diagnosed with COPD tells the nurse that he has been expectorating rusty-colored sputum. Which medication should the nurse anticipate the HCP prescribing? 1. Prednisone. 2. Nicotine. 3. Dextromethorphan. 4. Ceftriaxone. The correct answer is 4. Ceftriaxone. Ceftriaxone is an antibiotic. The client's rusty-colored sputum indicates an infection, and an antibiotic should be ordered. Rocephin is a broad-spectrum antibiotic. Prednisone is a glucocorticoid. Clients diagnosed with COPD are commonly prescribed a steroid medication to decrease inflammation in the lungs. This client should already be taking this or a similar medication. The client should quit smoking, if still smoking. A transdermal nicotine system, such as Habitrol, would be anticipated to aid the client. Dextromethorphan is an antitussive. The client may require an antitussive, but more likely would require a mucolytic to help to expectorate the thick, tenacious sputum associated with COPD.
In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions? Select all that apply. 1. Plan regular times for taking medications. 2. Arise slowly from bed. 3. Avoid standing still for long periods. 4. Avoid excessive alcohol intake. 5. Avoid hot baths. The correct answers are 2 and 3. Changing positions slowly and avoiding long periods of standing may limit the occurrence of orthostatic hypotension. Scheduling regular medication times is important for blood pressure management, but this aspect is not related to the development of orthostatic hypotension. Excessive alcohol intake and hot baths are associated with vasodilation.
Using the Neonatal Infant Pain Scale, NIPS, a nurse is assessing the pain response of a newborn who has just had a circumcision. The nurse is assessing a change in which of the following signs, symptoms. Select all that apply. 1. Heart rate. 2. Blood pressure. 3. Temperature. 4. Facial expression. 5. Breathing pattern. The correct answers are 4. Facial expression and 5. Breathing pattern. Facial expression is one variable that is evaluated as part of the NIPS. Breathing pattern is one variable that is evaluated as part of the NIPS. Although assessed in other pain scales, the heart rate is not part of the NIPS. Blood pressure is not assessed in any infant pain scale. Temperature is not assessed in any infant pain scale. You should be familiar with the pain rating scales and use them clinically because neonates cannot communicate their pain to the nurse. The scoring variables that are evaluated when assessing neonatal pain using the NIPS are facial expression, crying, breathing patterns, movement of arms and legs, and state of arousal. Other tools for assessing pain in the neonate are the Pain Assessment Tool, the Neonatal Post-Op Pain Scale, and the Premature Infant Pain Profile. The client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? 1. There are no medications to treat this problem, but losing weight will sometimes help the symptoms. 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. 3. Have you had any X-rays or other tests to determine if you have cancer or some other serious illness? 4. Acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. The correct answer is 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. PPIs, H2 blockers, and antacids all treat the symptoms of acid reflux. The nurse should encourage the client to discuss which medication is best with the HCP. Sometimes losing weight will help relieve symptoms, but the client did not ask about lifestyle modifications. The symptoms do not indicate cancer. The nurse should not scare the client. Acid reflux can lead to complications, including adult-onset asthma that should be treated, but most HCPs will empirically treat the symptoms of acid reflux before ordering tests to determine the cause or possible complications. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about this medication is effective when the client makes the following statement. Select all that apply. 1. I will take my weight daily at the same time each day. 2. I will not drink alcoholic beverages while on this medication. 3. I will reduce salt intake in my diet. 4. I will reduce my dosage if I have severe dizziness. 5. I will use sunscreen if I have prolonged exposure to sunlight. 6. Take the drug late in the evening. The correct answers are 1, 2, 3, and 5. Chlorothiazide causes increased urination and decreased swelling and weight loss. It is important to check and record weight 2 to 3 times per week at same time of day with similar amount of clothing. Clients should not drink alcoholic beverages or take other medications without the approval of the healthcare provider. Reducing sodium intake in the diet helps diuretic drugs to be more effective and allows smaller doses to be taken. Smaller doses are less likely to cause adverse effects, and hence excessive table salt, as well as salty food, should be avoided. Chlorothiazide is a diuretic that is prescribed for lower blood pressure and may cause dizziness and faintness when the patient stands up suddenly. This can be prevented or decreased by changing positions slowly. If dizziness is severe, the healthcare provider must be notified. Diuretics may cause sensitivity to sunlight, hence the need to avoid prolonged exposure to sunlight, use sunscreens, and wear protective clothing. Chlorothiazide causes increased urination and must be taken early in the day to decrease nighttime trips to the bathroom. Fewer bathroom trips mean less interference with sleep and less risk of falls.
A 4-month-old is brought to the emergency department with severe dehydration. The heart rate is 198, and her blood pressure is 68/38. The infant's anterior fontanelle is sunken. The nurse notes that the infant does not cry when the intravenous line is inserted. The child's parents state that she has not held anything down in 18 hours. The nurse obtains a fingerstick blood sugar of 94. Which would the nurse expect to do immediately? 1. Administer a bolus of normal saline. 2. Administer a bolus of D10W. 3. Administer a bolus of normal saline with 5% dextrose added to the solution. 4. Offer the child an oral rehydrating solution, such as Pedialyte. The correct answer is 1. Administer a bolus of normal saline. Dehydration is corrected with the administration of an isotonic solution, such as normal saline or lactated ringer solution. Solutions containing dextrose should never be administered in bolus form because they may result in cerebral edema. Severe dehydration is not usually corrected with oral solutions. Children with altered levels of consciousness should be kept NPO. You should immediately eliminate answers 2 and 3 because they both suggest administering glucose in bolus form, which is always contraindicated in pediatric clients. Answer 4 should be eliminated because the infant is severely dehydrated and not responding to painful stimulation, which is suggested by the lack of a cry on intravenous insertion. The home healthcare nurse is caring for a male client diagnosed with a hiatal hernia and reflux. Which data indicates the medication therapy is effective? 1. The client takes the antacid 1 hour before and 3 hours after a meal. 2. The client reports indigestion after eating a large meal. 3. The client states that he did not wake up with heartburn during the night. 4. The client has lost 3 pounds in the past 2 weeks. The correct answer is 3. The client states that he did not wake up with heartburn during the night. Option 3 indicates an improvement in symptoms and that the medication is effective. Option 1 indicates client compliance with the dosing regimen for antacids, not that the medication is effective. The return of symptoms in Option 2 indicates the medication is not effective. In Option 4, losing weight would not indicate that a medication for hiatal hernia is effective.
The nurse is developing a care plan with an older adult with hypertension and is instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. 1. Cerebrovascular accidents. 2. Liver disease. 3. Myocardial infarction. 4. Pulmonary disease. The correct answer is 1. Hypertension is referred to as a silent killer for adults because until the adult has significant damage to other systems, the hypertension may go undetected. CVAs can be related to long-term hypertension. Liver or pulmonary disease is not generally associated with hypertension. Myocardial infarction is generally related to coronary artery disease.
The nurse receives a call from the parent of a 10-month-old who has vomited 3 times in the past 8 hours. The parent describes the baby as playful and wanting to drink. The parent asks the nurse what to give the child. Select the nurse's best response. 1. Replace the next feeding with regular water and see if that is better tolerated. 2. Do not allow your baby to eat any solids. Give half the normal formula feeding and see if that is better tolerated. 3. Do not let your baby eat or drink anything for 24 hours to give the stomach a chance to rest. 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. The correct answer is 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. Offering small amounts of clear liquids is usually well tolerated. If the child vomits, make them NPO for an hour to allow the stomach to rest and then restart fluids. The child in this scenario is described as playful and therefore does not appear to be at risk for dehydration. Free water should not be given because it does not contain any electrolytes and can lead to critical electrolyte imbalances. Formula should be avoided, and clear liquids such as Pedialyte should be offered. 24 hours is too long for the infant to remain NPO. The infant needs to drink a rehydration solution, such as Pedialyte, in order to avoid severe dehydration. You should eliminate answers 1 and 3 because they could cause harm to the infant. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A child is diagnosed with chronic constipation that has been unresponsive to dietary and activity changes. Which pharmacological measure is most appropriate? 1. Natural supplements and herbs. 2. Stimulant laxative. 3. Osmotic agent. 4. Pharmacological measures are not used in pediatric constipation. The correct answer is 3. Osmotic agent. A stool softener is the drug of choice because it will lead to easier evacuation. Natural supplements and herbs are not recommended because the safety and efficacy are not standardized. A stimulant laxative is not the drug of choice because it may increase abdominal discomfort and may lead to dependency. Although diet and activity modification are tried first, medications are sometimes needed. You should eliminate answer 4 because it implies that medications are never given to the constipated child. In healthcare, there are very few cases of never and always. The client diagnosed with severe ulcerative colitis is prescribed azathioprine. Which assessment data concerning the medication warrants immediate intervention by the nurse? 1. Reports of a sore throat, fever, and chills. 2. Reports of 10 to 20 loose stools a day. 3. Reports of abdominal pain and tenderness. 4. Reports of dry mouth and oral mucosa. The correct answer is 1. Reports of a sore throat, fever, and chills. Azathioprine is an immunosuppressant and can cause a decrease in the number of blood cells in the bone marrow. Signs or symptoms that would warrant intervention by the nurse include sore throat, fever, chills, unusual bleeding or bruising, pale skin, headache, confusion, tachycardia, insomnia, and shortness of breath. 10 to 20 loose, watery stools a day are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Abdominal pain and tenderness are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Dehydration may occur with ulcerative colitis, but it does not warrant intervention by the nurse secondary to the medication.
Which concept is reflective of Erik Erikson's theory of personality development? 1. Defense mechanisms help people to cope with anxiety. 2. Moral maturity is a central theme in all stages of development. 3. Achievement of developmental goals is affected by the social environment. 4. 2 continual processes, assimilation and accommodation, stimulate intellectual growth. The correct answer is 3. Achievement of developmental goals is affected by the social environment. Rationale. Erik Erikson expanded on Freud's theory of personality development by giving equal emphasis to the influence of a person's social and cultural environment. He stressed that psychosocial development depends on an interactive process between the physical and emotional variables during a person's life at 8 distinct stages. Each stage requires resolution of a developmental conflict that has opposite outcomes, and that requires interaction within the self and with others in the environment. Sigmund Freud, not Erik Erikson, identified that defense mechanisms are used to reduce anxiety by preventing conscious awareness of threatening thoughts or feelings. Lawrence Kohlberg, not Erik Erikson, established a framework for understanding the development of moral maturity, which is the ability to recognize independently what is right and what is wrong. Assimilation and accommodation of new information necessary to stimulate intellectual growth comprise a concept basic to Jean Piaget's theory of cognitive development, not Erikson's theory of personality development. Assimilation involves the process of organizing new information into one's present body of knowledge, and accommodation involves rearranging and restructuring thought processes to deal with the imbalance caused by new information and thereby increase understanding. A family member requests relief from caring for a relative who has a history of excessive intake of alcohol and a rapidly debilitating malignancy. To which resource should the nurse refer the family member for respite care? 1. Hospice. 2. Meals on Wheels. 3. Ambulatory Care Center. 4. Substance Misuse Treatment Center. The correct answer is 1. Hospice. Rationale. A hospice program is an example of an agency that may provide or arrange for respite care in a healthcare facility or in the home. The caregiving role is physically and emotionally grueling, and family members may need relief from the caregiving role or a break to attend a family function or go on vacation. Meals on Wheels does not provide respite care. It provides nutritious, low-cost meals for homebound people so that they can remain in their own homes. Ambulatory care centers do not provide respite care. Ambulatory care centers provide care for people with conditions that do not require hospitalization. Services may include diagnosis and treatment of disease and illness, as well as simple surgical procedures in which the client returns home the same day. A substance misuse treatment center does not provide respite care. It provides a specialized service in the care and treatment of individuals who misuse alcohol or drugs. A nurse must collect information about a community to identify its needs, which is the most significant assessment by the nurse. 1. The demographics of the community. 2. What the community thinks is important. 3. How many support services are available. 4. Environmental data as they relate to public safety. The correct answer is 2. What the community thinks is important. Rationale. The members in the community are the primary source of data about the community and its needs. Just as the client is the center of the healthcare team when caring for an individual, the collective membership of a community is the center of the healthcare team when caring for the healthcare needs of a community.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client's contract for home care services is about to end, but the client still requires care. On which factor will the continuation of services initially depend? 1. Nursing documentation of the need for care. 2. Retrospective audits of quality management. 3. Client satisfaction with the care being provided. 4. Presence of a primary healthcare provider's prescription. The correct answer is 1. Nursing documentation of the need for care. Rationale. Case management by the nurse in the home care setting includes determining whether a client is ready for discharge or requires a continuation of services. The nurse must document objectively the status of the client to convince those making the decision that the client requires a continuation of services. Nursing documentation is the initial intervention that supports the decision to continue home care services. Quality management activities are unrelated to whether a client is to receive a continuation of services or is to be discharged from a home health care program. Ongoing quality management programs are designed to monitor the quality of care being delivered and identify problem areas so that efforts can be employed to improve care. Dissatisfaction with the services of a home health agency may influence whether or not the client and/or family wants a continuation of services. However, satisfaction or dissatisfaction should not influence whether the client still needs the services of the home health care agency. Ultimately, a primary health care provider's prescription is necessary to initiate home care services, continue health care services, and identify interventions to be performed by nurses that are within the scope of nursing practice. However, the healthcare provider's prescriptions take into consideration nursing documentation of the need for care and input from agency managers and the client's insurer. A home care nurse is performing an initial client and home assessment, which is the most essential assessment that must be made by the nurse. 1. Can the home environment support the safety of the client? 2. Is the family willing to participate in the client's recovery? 3. Does the client have the potential for self-care? 4. Can the client participate in the plan of care? The correct answer is 1. Can the home environment support the safety of the client? Rationale. The first and most important assessment made by the home care nurse focuses on determining whether the client's home environment is safe. Safety and security are one of the more basic needs identified by Maslow's hierarchy of needs. Although it is often helpful when family members participate in a home care client's recovery, it is not necessary. A client's potential for self-care is not a criterion for receiving home care services. Clients who have little or no potential for self-care receive home care services. Clients who are unable to participate in the plan of care because they are mentally, emotionally, or physically disabled are still eligible for home care. A nurse must conduct a community assessment. Which information should the nurse collect first? 1. General health of community members. 2. Characteristics of community members. 3. Physical environment of the community. 4. Social services available in the community. The correct answer is 2. Characteristics of community members. Rationale. Clients are the center of all healthcare, including community healthcare. Acquiring core information about the people in the community is the first stage in assessing a community. Core characteristics about the members of a community include information such as vital statistics, values and beliefs, demographics, religious groups, and so on. A community health nurse is to care for a client who was just discharged from an acute care facility after receiving initial medical care for tuberculosis. The family recently immigrated to the country from another country. Place the following interventions in the order in which they should be performed by the nurse. 1. Explore community resources that can help support the client and family. 2. Perform an assessment of the client and home environment. 3. Meet with the client and family in their home. 4. Review the client's medical record. 5. Identify client and family needs. The correct order is 4. Review the client's medical record. 3. Meet with the client and family in their home. 2. Perform an assessment of the client and home environment. 5. Identify client and family needs. And 1. Explore community resources that can help support the client and family. Rationale. Before meeting with the client and family, the nurse should obtain as much information about the client as possible. An assessment of the home environment can be performed only in the home. The client's family members should be included when feasible because they may provide emotional support or be involved with physical care of the client. A health history and physical assessment of the client should be performed by the community health nurse. The information on the client's clinical record may not reflect the client's current status. The home must be assessed to ensure that it is a safe environment for the client and that care can be delivered adequately to meet the client's needs. The nurse, in conjunction with the client, must identify present needs. Once this is accomplished, then goals and objectives can be identified and a plan of care formulated. Once a plan of care is formulated, then the nurse, in conjunction with the client, can identify community resources that may assist them in attaining the goals and objectives of the plan of care.
The client diagnosed with type 2 diabetes is receiving the combination oral medication glyburide metformin. Which data indicates the medication is effective? 1. The client's skin turgor is elastic. 2. The client's urine ketones are negative. 3. The serum blood glucose level is 118 milligrams per deciliter. 4. The client's glucometer level is 170 milligrams per deciliter. The correct answer is 3. The serum blood glucose level is 118 milligrams per deciliter. Glyburide metformin contains both the sulfonylurea and a biguanide. The serum blood glucose level should be within normal limits, which is 70 to 110 milligrams per deciliter. A level of 118 milligrams per deciliter is close to normal. Therefore, the medication can be considered effective. An elastic skin turgor is expected and normal, but it does not indicate that the anti-diabetic medication is effective. Urine ketones should be negative because there should not be a breakdown of fat in clients with type 2 diabetes, but this does not indicate the effectiveness of the medication. A self-monitoring blood glucose level of 170 milligrams per deciliter is above a normal glucose level. This indicates the medication is not effective. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.